Good afternoon and Assalamualaikum. My name is Dr. Nur-Run. I'm currently a consultant psychiatrist working at KPJ Damansara Specialist Hospital. So this afternoon, I've been sort of tasked to talk about mental health in the current pandemic. It's a very topical issue. I think of late, a lot more people are aware of issues related to mental health. And I'm sure that there are also some people may not be as aware. So for the next, few minutes, I'll be talking just a general overview, giving you a bit of basic and background about sort of mental health and what that means. And also, invite any questions. So if you have any questions, please sort of message it or send it forward, and someone will sort of prompt me to answer some of the questions. Okay. So apa maknanya tu mental health? And banyak orang get sort of confused or they don't know what about it. They tend to separate mental health from physical health. But if you think about it, actually, you tak boleh separate the two because it's actually we are one body. So zaman dulu, the Cartesian model kata, it's a separation between mind and body. Tapi sekarang ni, I think lebih banyak orang aware that actually you can't separate them both. Mental health, actually WHO, the World Health Organization, dah bagi definition, ada meaning for what health mean, what's a good health. And basically, in their definition, dia kata it's a state of well-being from the physical, mental, and social well-being. So they cover all the aspects. So not just from physical side, but also from mental and social. When you're referring to talking about mental health, you're looking at the state of well-being from the sort of mental perspective that seseorang itu boleh merealisasikan or realizes their own potential, that they can cope with the normal stresses in life, that they can be productive and boleh positively contribute to the community. So this doesn't mean that being sort of mentally healthy, ataupun they like to use the word mental well-being, doesn't mean that you have to be 100% happy all the time, because our life is full of stresses, and there'll be ups and downs. As long as you are able to enjoy and gain satisfaction from your life, generally, that's sort of good enough. So sekarang ni masa pandemic, there's a lot of issues, a lot of stresses. Kita orang sekarang ni dalam a very unusual time, not just stress about the infection itself, whether you're gonna get exposed to the risk of infection, tapi also there's also worries about financial problems, pasal kerja, jobs, and there's also issues about all of these increase the stress to that person. So there's clear, now the evidence are clearer. Sekarang there's more information because that shows that during the current time, such stresses have led to negative psychological consequence to the general population. So they have buat studies not just in China, but it's been replicated all over the world, macam Denmark, and Iran, etc. They found that people punya general well-being, whether it's mental health and physical health, it's actually in recent times are poorer lebih compared to before the pandemic. So that's quite clear. So that there's a clear impact of the pandemic on someone's sort of psychological and physical well-being. Dari segi when we talk about stress is benda-benda yang external, and it's a word that people use commonly. And macam mana you tahu you stress, and there's overlap between the symptoms of stress and other symptoms such as anxiety. They won't share similar symptoms. For example, when you're feeling stressed, you cannot concentrate as well. Tidur pun tak lena, so there's sleep problems, you're not able to eat as well. So all these stresses can affect you, just not from physical side, for example, feeling more tired and more rasa takut or resah, but also it can affect you sort of mentally as well. You cannot focus, you cannot manage or cope with day-to-day things. So sekarang ni masa pandemic, there's a lot of stresses, not just macam sekarang, previously during the quarantine or the lockdown, there were restriction in the movement, so the daily activities, the daily routine got interrupted. So that in itself is a stress. Some people find that working from home is stressful, some people tak, because it's less commute. But that can be a source of stress. Some people have lost their job, especially in the aviation industry. A lot of people, having to find alternative way to make a living. So that in itself, financial pressure, create a big, huge stress as well. And it's interesting in terms of the implication also by being at home, because you would think that being at home, tak payah pergi kerja, you with your family. Some people find it as a positive experience, but also it's well now reported all over the world that just being in such close contact with family members or people that you know, that there's been increased reported of domestic violence. And when we talk about domestic violence, it's not just apa tu, they called it intimate partner violence, bermakna there's violence against your spouse or your partner, or husband or wife. It's not gender specific, but also the domestic violence also include violence or abuse towards children. And sometimes it's not physical, sometimes it can also be neglect, you tak jaga the child properly. And the other population that we tend to forget is the elderly population, orang tua-tua, in such sort of high pressure environment. These are the vulnerable group. So it's well known across the world, across all the continent, even in South America, in Europe. Few weeks after the lockdown, there were increased reported cases of people accessing helpline, accessing the website of organisation yang help women, mainly it's women and children yang facing this sort of violence, and also sort of reports cases. Now there's not enough data to say in terms of whether it led to increase in homicide, is someone kena bunuh by their partner or things like that, because it's too early. But there's concern that such situation can head that way. So the stress generally in terms of the pandemic, can cause a lot of problems, disrupt life, and I think it's not just from the financial side, from your routine side, loss of structure, and it's not just adults. I mentioned before, children also affected. Sekarang sekolah is a lot of the sekolah is online, especially young children. The disruption in pergi sekolah, they actually part of their development is interacting with other children. So that part has been sort of missing in the past 10 months. So there's concern from that side of things, and children spending too much time on their screen. Screen ni tak semestinya iPad, it can be phone atau television atau computer. So there's concern that children are spending too much time on screen rather than playing or doing other things that they should. So the impact is across all layers. The other group that I want to mention that has significant impact from this pandemic is the healthcare workers, the frontliners. There's clear studies across that shows recently from the COVID that shows that actually the effect on healthcare workers are significant in their physical and emotional well-being. Banyak the healthcare workers, for example, have problems with sleeping, feeling sort of stress, symptoms of anxiety and depression also can be detected in this group of people. So they are quite vulnerable group of people, and because of workload, and the cases that they've seen, the long hours, these are all very sort of stressful. And I think it's worth thinking about that because currently we're seeing further increase in cases, and everybody sort of are worried and anxious about it, and everybody's on the edge to see where it is. So I think before I go on in terms of what you can do, I can invite some questions if anybody has come through. Tak ada? Okay, tak ada lagi. So the other aspect in terms of the effect of the pandemic is actually on is particular in the people who are more sort of sensitive ataupun dipanggil vulnerable. So for example, people who have previous history of mental health problem, people who are of lower socioeconomic class, so these are another sort of vulnerable group of people. Because the restriction that they pose, they might have difficulty in accessing help, just like people who were facing domestic abuse. The difficulty is that for them to access help readily. So and people with long-term mental health problem, I think now the restriction has lifted. It's easier to access problem, but you have to bear in mind in terms of people probably not as regular in accessing help as they would. But things are in place. So there are helplines that's available, and people are trying to accommodate, making it easier for people to access help. For example, in certain parts of the world, they use telepsychiatry. People can be assessed instead of coming in. The doctor can assess them through sort of a computer or through a media phone device. So that is an alternative. Tapi locally kat Malaysia, I know there are helplines available. For example, talian kasih for people who are facing domestic abuse. There's a number where you can call anytime. But there's also existing service that been around for a long time. For example, the befrienders. People who are in distress, they can call the number to have someone sort of to talk to. So that is help available locally. So when we talk about macam distress, the stress itself can make someone. Some people cope very well, but if the stress continue on, it becomes too much. It can lead to a mental illness. So when we talk about mental illness atau mental disorder, maknanya you have a list of symptoms, and that the symptoms are bad enough in terms of really severe, really intense, ataupun going on for far too long, that is affecting that you cannot function normally, you cannot work normally, you cannot create problems in your relationship with your family or friends, and you stop going out socially. So when this happened, maknanya it started to become problematic. that those stress can sort of lead to someone developing a mental illness. And I think in terms of recognizing, when this happened, the awareness, when do you ask for help, that can be quite challenging to some people. Because some of these things they are not familiar with. They tak tahu, what's happening, and a lot of people they just put up with it, and until it get really bad, until someone commented, someone noticed, or someone ajak dia to seek help, baru people seek help. But I'm enlightened to know that recently, seems to be, especially the young people, they seems to be a bit more aware of what's going on and about mental health issues, that people are seeking help more. And I certainly seen this in clinic in the past month. Okay. So going back, in terms of the other common problems from sort of the stress of things, especially in the context of pandemic, we've noticed that a lot of people have sleep disturbance. This is a very, very common complaint. Tak boleh tidur, atau kalau tidur pun tak lena, ataupun kalau tidur pun asyik bangun saja, or bangun pun really early. So the sleep disturbance is quite a prominent problem, especially in current time. And okay, before I answer the question, I'll just finish about the sleep. So when going back to the sleep, so kalau you don't have enough sleep, you don't get enough rest, and when you don't get enough rest, you don't feel good enough to manage day-to-day things, especially day-to-day stress or problems. So getting good rest is really, really important. And sleep is a funny thing, but sleep is actually one of the things that you need to have a good habit. You need to tidur at the same time. You need to do certain things. For example, avoiding coffee, tea, or any caffeinated drink. Quite some hours, 5-6 hours before your bedtime. You need to make sure yang tempat tidur, your bed is tempat untuk tidur, not to play on your phone, not to watch TV. So, if you do things like this, it can help to encourage better sleep. Exercise is another really important thing. I'll talk about it a bit later, but it can also promote sleep. Okay, so there's a question. When someone experiences acute anxiety attack, what's the best thing to do other than deep breathing? Okay, so bearing in mind, any advice I give on this is general, so I'm not giving anyone sort of specific advice, but a general sort of basic concept that I hope that some of you can find useful. So anxiety attack is very similar in terms of your reaction when you're very stressed. You will notice masa anxiety, it does changes to your body. Your heart will beat very fast. You start to breathing very fast. You get sweaty. Your body is actually ready to lari, flight, or to fight. That's what they call it, the fight and flight response. So and then some people, when they get in this state, they start thinking, oh, am I gonna is something bad gonna happen to me? Am I gonna have a heart attack? And sometimes it gets so extreme that these anxiety symptoms become what we call a panic attack. Okay, but it doesn't necessarily lead to panic attack. So why do I mention that? Actually, a lot of these anxiety symptoms, it's not just in terms of your physical reaction, it's also your thoughts, what you do, but also what your behavior as well. What do you do in that situation? Some people, they notice a clear pattern. For example, they get anxious in certain situation. Common example would be they get anxious masa keluar rumah. They start getting anxious. Tapi kat rumah, they have no problem. Or when they meet new people, So some people, there's clear macam trigger. So if you know their pattern, what trigger it can help you to manage it. But then the other question is, I think, what you do with that as well. So that's the behavior bit. So sometimes it becomes sort of not useful behavior. You start avoiding going out altogether, or you stop avoiding meeting people altogether. So sometimes this behavior can be negative, or it can reinforce the behavior, the avoidance, and it can sort of fit into the cycle of the anxiety. So that one we with a doctor or therapist, is something that probably need to explore, macam thinking about alternative way to manage that. But going back in terms of how do you manage when you have anxiety, the first thing first is actually recognizing that you started to become anxious. When, instead of dah terlambat, when you're really panicky and you really need to get out of the situation, a lot of people normally notice that it's slowly build up. So if you're able to notice it in the beginning, when it was building up, you can put things in place. Deep breathing is one of the things you can put in place, but I think it's a bit more than deep breathing. Some people mention about progressive muscle relaxation in terms of tensing your muscle and slowly work from your kaki to your hand. That might be an option. Tapi bear in mind, you have to probably try different techniques first and find something that suit you. Because maybe for you the deep breathing doesn't really work, but for some other people it works beautifully. So you can try a few techniques to find which one suit you.
There's one more question.
Yeah.
I've got questions coming in. Another one is, how do we convince and encourage our friends and family to get help for their betterment?
Okay. So first of all, I don't know whether people can hear. So how do we encourage family or friends to access help? So the good thing about that question is that means they notice that there's something their friend or their loved one is not need help. So for noticing that's a bonus point already. So what do you do with that? I think approaching someone in a sort of non-judgmental, more in terms of compassionate way. Tanya, is there something that's troubling you? Trying to find out from them what they think is a problem, and whether there is a problem, and what they feel that they need. So getting the person to share their punya difficulty with you. If it's something that you really worried because this person buat something macam tak safe, tak selamat. For example, they might drive recklessly, or they might put themselves or other people in danger. You punya threshold to ask for help maybe must be lower. You probably need to get that person to be seen by someone quickly. Tapi I think the first and foremost, in terms of supporting them, being open and non-judgmental to them, and supporting them, if they feel they need help, to facilitate, to tolong diorang to get that help. Sometimes you can, some of this problem, you just need you probably don't need to see a psychiatrist straight away. Maybe the problem is more that can be managed elsewhere. For example, if it's clear money problem, maybe assessing someone that can give practical advice will be more useful to that person. So you probably have to macam tailor what the problem is. Tapi get them on board, get them on your side, because it's very hard. It's worse if they don't recognize and they don't want to do anything. It's harder to push them for help.
Okay, another question. Is it expensive to seek professional help, especially if the cause of anxiety stems from expenses?
Okay, good question. Yeah, the cost issue and finances are real concern. So the question was, is it expensive to seek professional help? I think it varies to where you access the help from. If you're talking, when you said health professionals, you have many different type of mental health professionals. People always get confused between psychiatrists and psychologists. That's a common question I get all the time. And counselor, what's a counselor? So I think in terms of taking a step back in terms of maybe the first hand in terms of if you're not sure what help you need, seeing a primary care doctor, doctor kat clinic, they can assess what kind of help you may need, whether you need a further specialized help or not. If that is not if you prefer to go straight to the source in terms of in general, if you access sort of public service, Kementerian Kesihatan or hospital, university, those they're very reasonably priced, but obviously they are very the resources is limited, so mungkin you're probably not able to see them as quickly, but that is the beauty of Malaysia, is we have that option. Private sector is also an option. How costly, it depends on the skill set and whether you're seeing a doctor or a psychologist. The Ministry of Health has set a guideline in terms of a price range that the whoever the professional you see, they have to abide within a range. So sometimes you might have to sort of call and check on the price. I know I looked it up before in terms of if you're talking about therapy sessions, some places they offer packages of few sessions and you get a bit cheaper. Some people give sort of significant reduction for a certain income group, like the B40. So I think you probably need to sort of shop around a bit, but it can, it can cost, depends on what you can afford. But I think in terms of, I'm not sure, I can't quote in terms of range available, but I presume in terms, you can look it up actually, Ministry of Health has a cap range in terms of the price.
So that's okay. There's another question. What if, macam mana nak tahu if our loved ones, whether they are having sort of episode of depression ke tak? Kadang-kadang orang tu tak bagi tahu kan, dia pendam.
Okay. So question is, macam mana you tahu someone have depression or not? Particularly kalau dia tak cakap about it, don't talk about it. None of us are mind readers, psychiatrists included. That's another common misconception about psychiatry. Say, oh, you can read my mind. So yeah, I think the reality of it, none of us can read other people's mind. How do you know? I think as an observer, you can see whether there's been change in dia punya behavior. Was there a change from that person was normally quite chatty, quite sociable, and then sekarang tak keluar rumah, tak take care of themselves, tak cakap pada orang, tak makan, tak minum. So you can, if there's significant change in their behavior, that give you a clue that something is not right. So forcing someone to talk is not very easy, and that's why macam psychiatry, in certain parts of the world, I'm sure in Malaysia as well, sometimes you admit people, up to 28 hari to assess whether they have mental illness or not. Sebab, you can't force someone to share what's in their thoughts because it's very private. So sometimes it's a period of observation. But if you gain their trust, if you have a good relationship with them, again, trying to understand from their perspective, that can help. But just observing behavior, change in presentation, that will give you a clue whether there's something worrying is happening.
Yeah. Another one, because the schools are reopening.
Yes.
Right? So can you give your opinion on school? In terms of emotional, can these kids take it or not?
For going back to school, not going back to school. Can the kids take it or not? Yeah, I think personally, children are quite resilient. Resilient maknanya quite tough lah. They can face. They don't know any better. They just get on with it. Normally, yang worrynya the parents, which is understandable in the current context. So when you say my opinion on what you think how the children will cope or how the children will fare off, I think a few things. I guess in terms of decision to buka sekolah, I'm sure they already assessed the risks from Ministry of Health, Ministry of Education. They assess the risk. And my understanding locally, some school, especially the international school, dah buka face-to-face. And the rationale, from my understanding, I might not be right, is that because they notice that the clusters that affected are not school related, macam clusters at workplace or sort of really confined places, accommodation, workers were. So my understanding is they made the risk assessment that is safe enough, provided the sekolah maintain and has a good SOP. So in terms of the children going, in terms of normally it's the parents' concern, or am I exposing them to this risk? I think parents will individually need to make the decision. But for the children themselves, I think depends on what age of the children as well. Part of the school, especially in primary setting, is that it's not just about academia, it's also about social development. Maknanya dia orang punya interaction with their friends their age. That is important as well, not just learning to read and write. In terms, but how can the children manage that? I think purely for going to school, I think they're quite capable. But I know some children are probably anxious, worried, takut nak pergi because hear all this news about COVID. So in this situation, I think in terms of the parent, explore, have that conversation with the child, explore in terms of what exactly their concern, and try to support them. Some of it is just about information giving. Some of it maybe just in terms of the child just want to be comforted and feel safe. So I don't know whether that answer your question or not. Tapi that's in terms of for sekolah. That's a big issue now because I know a lot of parents are worried. Hantar sekolah, exposing them to risk. I think each parent, the concern is real, understandable. The children themselves, I think most children, I think would be, they're quite tough. They can manage that kind of challenges.
Another question.
Yeah.
Some people are afraid to come forward and share their mental issues, right?
Mm-hmm.
So what if they go to the other options, which is online mental assessments and stuff? Are those reliable?
There's no replacement by seeing a professional. Okay, the online assessment normally they are rating tools of some sort. Maknanya they ask a list of questions and then they try to see, triangulate the result to find out what best fit. But those kind of tools, they macam guide. They guide where what if it's an issue or what kind of personality. That's quite a common thing that people do online. They just guide in terms of roughly where you are. It's not macam when we talk about any tests, there are two things that we look for. Is it valid? Valid maknanya does it actually test what it's supposed to test? Does it give a good picture of what's going on? And the other thing about tests, we look at whether it's reliable. Whether if different people do it, whether they will get a reasonable result. Personally, I think nothing replaced in terms of a skilled, specialized assessment. Because it's more than just sort of categorizing you into A, B, or C group. It's a bit more than that. And if you're talking about trying to understand the person as a whole, there's a lot of sort of background history, information that normally the doctor or the therapist need to know as well. So it's not just in terms of ticking boxes, but it can be quite a good guide. So some of the ratings tool that even the doctors or the therapists use, we use not to confirm, because normally we diagnose people based on the clinical assessment, tapi it gives us a guide, macam monitor some of the symptoms, so it's useful in that way. Tapi if you're thinking macam there's so many online tools, mana satu you nak pick? You can do hundreds of different questions online, and you might get positive results of many different tools. But is it a true reflection of your problem? I don't know. I don't think so. I think it's a bit more than that. Yeah.
That's okay. We'll take this last question.
Yeah.
Do you have any tools to measure somebody's level of stress?
So it's related to the interesting. So the question was, do I have any tool to measure someone's stress? Okay. And relate to the previous question, we do. It's quite common to use some sort of tool. When we talk about tool, it's normally a list of questions and ada macam rating, how you rate that item to you. How does it relate to you? So some of this tool we use as screening, macam nak to pick up the problem. So for example, if you see the doctor in klinik kesihatan and they see hundreds of patients, dia tak ada time nak go through all the questions. So bagi patient, the tool is useful to pick out mana satu yang probably have problem, anxiety or depression. So when you use the tool in this case, it's called screening. You tapis, which one actually have problem, and then you can focus on them. Okay. So tool is useful from that side, and there are tools for anxiety and depression that we use commonly. So the other way to use the tool, like I mentioned before, is in terms of for monitoring purpose. Macam how severe was your anxiety before before you have treatment, and then compare that after you start treatment, whether ubat or therapy. How is your level of anxiety then? You can the tools are useful sebab dia bagi more objective measure. You nampak, you can compare. But often we always use our clinical judgment. Maknanya, as a doctor, in terms of I'm able to compare, some things are that there's an improvement or not, or so we always. The tools are being used to support our clinical judgment and assessment. Yeah. Okay. Anything else? I guess in terms of, just to wrap it up, in terms, it's quite a big topic. I can go into many different direction, and I'm just aware, macam not to sort of overburden the people, the audience in terms of with information. Tapi so mental health is important. Just because it's just like your physical health. Sometimes you may have, if your body feel tired, but there's nothing sort of wrong with you. Probably wrong in terms of you tak ada illness, but you just feel tired sebab you tak cukup rest. So mental health is the same thing. So we have the spectrum where people are. Have difficulties, their well-being is interrupted because of stress or other factors, but it's not necessarily a mental illness yet. But then seeking help early, being aware and able to seek help early is really important. So there's a lot of avenues. There's a lot of information now online, but you have to choose which online information, your resource that you access is very important. Talk to someone if you recognize something is not right for you. Talk to someone. Doesn't have to be a healthcare professional. Maybe your friend or your family. Talk to someone, and that to some people that can be enough. But don't be shy, and don't put off if you feel that actually this is not me, and it's been going on far too long, and I'm not able to do what I normally do. You should seek help early, and then seeing someone, a doctor, a psychiatrist or a psychologist, that would be an option. Okay. So thank you very much. It's a big topic. If there is. I'm just aware in terms of if there's any particular topic that in the future might be useful. I don't know how they can feed it to you, but certainly it's something that sort of be happy to talk about. Okay, thank you very much for your time.